Honey, sit down. Pull up a chair real close because I need to tell you something that nobody, not your financial advisor, not your HR lady, not even your own children, is going to tell you before it's too late. I am 106 years old. I have outlived 2 husbands, a recession that nearly swallowed my house whole, and more government paperwork than any human being should ever have to see in one lifetime. I have seen things go right, and Lord knows, I have seen things go spectacularly, devastatingly wrong, and the one mistake that has cost me more money than almost anything else in my retirement, it wasn't a bad stock, it wasn't a scam, it wasn't even my ex-husband's credit card debt, it was missing a Medicare deadline that I didn't even know existed. $53 every single month, added to my Medicare bill for the rest of my natural life, because I signed up for Medicare Part B 14 months too late. 14 months, that's it. That's all it took to lock in a financial penalty that has followed me like a shadow for over 3 decades now. And here's the part that still makes my blood run a little hot when I think about it. Nobody warned me. Not a single soul. So today, that's what I'm going to do for you. I'm going to be the somebody who warned you. I'm going to tell you exactly what happened to me, exactly what this penalty is, exactly why it will hunt you down into old age if you let it, and exactly what you can do right now to make sure you never end up sitting in a rocking chair at 106 years old, shaking your head at a Medicare bill that didn't have to be this high. And before we go any further, if this kind of story is the kind of thing you need to hear before it costs you everything, you go ahead and subscribe to this channel right now. There are a lot of people out here trying to sell you something. We are just trying to make sure you don't lose what you already worked so hard to build. Now, let me start at the beginning. I turned 65 in the summer of 1983. Ronald Reagan was in the White House. My garden was producing the most beautiful tomatoes I had ever grown in my life, and I genuinely felt, like I had finally arrived at the good part. I had spent 40 years working, 40 years of early mornings and late nights, of making do with less so I could save a little more, of doing everything right. I had a pension from the school district where I'd worked as an administrative secretary. I had my savings. I had my Social Security lined up. And I had my retirement to look forward to. What I did not have was a clear understanding of Medicare, and that, sweet friend, was the beginning of my mistake. See, when you turn 65, the government opens a window for you. It's called your Initial Enrollment Period. You get 3 months before your 65th birthday, your birthday month itself, and 3 months after it. That's 7 months total to sign up for Medicare, Part A, which covers hospital stays, and Part B, which covers your doctors, your outpatient care, your preventative services, the things you use every single year. Part A, for most people, is free. You don't pay a premium for it if you worked and paid Medicare taxes for at least 10 years. So people sign up for Part A without blinking. Part B is different. Part B has a monthly premium. In 1983, it wasn't much. I think it was something like $12 a month. And here is where I made my critical error. I looked at that premium and I thought, I still have my husband's employer health insurance through his job. We are covered. I don't need to pay for something extra right now. I'll sign up when I actually need it. That thought, that completely logical, perfectly reasonable, absolutely devastating thought, is the thought that cost me, because here's what I did not know, what nobody sat me down and explained, what the paperwork certainly didn't make obvious in 1983. If you do not have what Medicare calls creditable coverage through a current employer, meaning your own job or your spouse's current active employment, and you miss your initial enrollment period, you will pay a penalty for every single 12-month period you were eligible but didn't sign up. That penalty is 10% of your Part B premium per year of delay, and it doesn't go away. It doesn't phase out after 5 years. It doesn't disappear when you finally get sick and really need the coverage. It is permanent. It is calculated fresh every year when they adjust the Part B premium. And it follows you. It followed me. Every month for 30-plus years, I have paid more for my Medicare than I should have, because of 14 months when I thought I was being financially smart. My husband retired when I was 66 years old. The moment he retired, his employer coverage ended. That's when I learned about the Special Enrollment Period, the grace period Medicare gives you when you lose employer-based coverage. I enrolled then, quickly, thinking I'd done everything right. And then the bill came. And there it was, a 10% surcharge on my Part B premium, because I had been uninsured, in Medicare's eyes, for 14 months after my 65th birthday, when my husband was still working, but I had no coverage of my own and had not enrolled. I called the Medicare office. I want you to know that I called. I explained. I asked if there was an appeal process, some form I could fill out, some way to explain what happened. The woman I spoke with was kind, but she was also very clear. The rules are the rules. There are some exceptions, but mine wasn't one of them. That 10%? It's been on my bill ever since. Now, I want you to really feel the weight of what I'm telling you, because the numbers are important and they are going to get bigger before we're done. Here is the thing about a percentage penalty on a premium that changes every year. It compounds in the worst possible way. When I first enrolled in 1984, the Part B premium was around $15 a month. My 10% penalty was $1.50. I thought, that's annoying, but it's fine. $1.50 a month. I can absorb that. But Medicare premiums don't stay at $15 forever. By 1990, the premium had risen to $29. My penalty was now almost $3 a month. By 2000, the premium was $45.50. My penalty was $4.55. By 2010, it was $110. My penalty was $11. By 2020, the standard premium hit $144.60. My penalty was $14.46 a month. And in 2024, the standard Medicare Part B premium is $174.70. My penalty, my original 10% for missing 14 months back in 1983 and 1984, is now $17.47 every month. Now I know what you're thinking. You're thinking, well, that doesn't sound like much. That doesn't sound like $53. Here's why it does sound like that for me. I turned 66 when I enrolled. I am 106. That is 40 years of paying this penalty, 40 years of a monthly surcharge. In total, across all those premium adjustments, across all those years, I have paid well over $15,000 more for my Medicare than I should have. $15,000 for missing a 7-month window when I was 65 years old. And every single month, I see it on my bill. Every single month, it is a reminder that information is money, that the rules don't bend for good intentions, that being unaware is not the same as being protected. Now here is what I want you to understand, because this is where your situation might be even more dangerous than mine was. In 1983, Medicare was relatively new, and the penalty was small in absolute terms. In 2024, if you miss your enrollment window and go 2 full years without signing up, your penalty is 20% of the current premium, permanently. If you go 3 years, it's 30%. The penalty increases by 10 percentage points for every 12-month period you were eligible and didn't enroll. And the current Part B premium? It goes up almost every single year. It has gone up in 39 of the last 40 years. So when I tell you that the penalty grows with the premium, it is not hypothetical. It is guaranteed. If you miss your enrollment window by 3 years today, you will pay 30% more than the standard premium for the rest of your life. And if you live as long as I have, that is not a nuisance. That is tens of thousands of dollars gone, quietly, monthly, automatically, without drama or fanfare, just steady, relentless, permanent loss. And the cruelest part is that you don't feel it happening. You don't have a moment where the money leaves your hands. It just isn't there. Month after month, year after year, you just have less than you should. So now I want to give you something useful, because I didn't just come here to tell you a sad old story about a mistake I made before some of you were born. I came here so that you can do what I couldn't, catch it before it starts. The rules, as best as I understand them now after 4 decades of paying very close attention, work like this. Your initial enrollment period is the 7 months surrounding your 65th birthday, 3 months before your birthday month, 3 months after. This is your golden window. If you are not working and do not have active employer-based health insurance, you sign up during this window. You sign up for both Part A and Part B. You do not wait. You do not assume your coverage from another source counts unless you have verified in writing with Medicare that it qualifies as creditable coverage. If you are still working at 65, truly working, actively employed, covered by your own employer's health plan or your spouse's current employer's plan, you have what is called a Special Enrollment Period waiting for you. When that job ends, when that coverage ends, you have 8 months to enroll in Medicare Part B without penalty. 8 months from when the employment or the coverage ends, whichever comes first. But here's what got me, and here's what gets people today. That SEP is 8 months from when the coverage ends, not 8 months from when you decide you need it, not 8 months from when you get around to calling, 8 months from the event. After that window closes, you are in open enrollment season, which only runs from January 1st to March 31st each year, and your coverage won't start until July 1st, and you will pay the penalty. There is also COBRA. COBRA is not creditable coverage for Medicare purposes in the way that active employer coverage is. If you lose your job and go on to COBRA instead of enrolling in Medicare, you may still be running down your Special Enrollment Period clock. This is a trap that catches a lot of people who think they're doing the right thing by staying on COBRA while they figure things out. There is also retiree coverage from a former employer. If your company gave you health benefits in retirement, that also is generally not considered creditable coverage that allows you to delay Medicare enrollment without penalty. It depends on the plan, but the burden is on you to verify. And if you don't verify and you're wrong, the penalty is waiting. Here is what I would tell my younger self, the one who stood in that garden in 1983 with those beautiful tomatoes, feeling like she had done everything right. Get yourself a folder. Label it Medicare. 3 months before you turn 65, you call 1-800-MEDICARE. You ask specifically whether your current health coverage qualifies you to delay Part B without penalty. You get that answer in writing if you can. You mark your calendar 7 months from 3 months before your birthday. That is your deadline. You do not let it pass. And if you are already working past 65, you put a reminder in that calendar for the day your coverage ends. 8 months from that day. That is your SEP window. You do not let it close without acting. You do these 2 things, and you will never sit where I am sitting. I want to say one more thing about this because I think it matters. The Medicare penalty is not just a financial problem. It is an emotional one. For all these years, every time I look at that Medicare summary, every time I see that surcharge, I feel the sting of a mistake I made when I was 65 and didn't know better. I feel the absence of information. I feel the weight of what I didn't know. And at 106, let me assure you, there are many better things to feel. Retirement is supposed to be the reward. It is supposed to be the part where the hard work pays off, where the savings count, where the planning protects you. And the Medicare Part B penalty is particularly cruel because it attacks you precisely at that moment. It punishes you for not knowing something technical and obscure at the exact moment you were trying to enjoy what you'd spent your life building. So this is my gift to you. This is what I can offer from 106 years of living and learning and paying penalties I didn't have to pay. Know the window, honor the deadline, verify your coverage, and never ever assume that because you feel covered, you are covered in the eyes of Medicare. Those are 2 very different things. If you are within 5 years of 65 right now, write these words down somewhere. Initial Enrollment Period, Special Enrollment Period, Creditable Coverage. Write them down and then go learn exactly what they mean for your specific situation. Because what they mean for you will determine whether you spend your final decades paying what you owe or paying what I paid. And if this video reached you in time, if you are watching this before that window has closed, then please do one thing for me, share it. Not because of the channel, not because of the views. Share it because someone in your life is probably 63 or 64 right now and has no idea this is coming. Share it because the best time to warn someone is before the mistake, not after. Subscribe to this channel too while you're at it. Every single week we bring you real retirement stories, the ones nobody tells at the financial planning seminar, the ones people are too embarrassed to put in a book. the ones that only come from living long enough and paying close enough attention. This community is built on one idea, that someone who went before you should make the road a little smoother. I am 106 years old. I have plenty more road behind me than ahead, but I still have enough of a voice left to make sure that what happened to me doesn't have to happen to you. The penalty will follow me until I die. It will not follow you, not if I have anything to say about it.